and welcome to today's American Association for Respiratory Care's Perspectives podcast, live from Congress 2024 with FACES Founder Sharman Lamka and this year's National Patient Advocacy Award honoree, Brigitte Trace. Thanks for joining us today and giving a little bit of background on FACES and patient advocacy. Sharman, can you tell us a little bit about the background of the FACES Foundation and why you started it?
Absolutely. FACES stands for Family and Caregiver Education and Support in the area of pulmonary illnesses and diseases of the lungs. My husband, Phil Lamka, passed away from complications of an interstitial lung disease. And at that time, we didn't know what a respiratory therapist was. We thought you came in, plugged his oxygen in, and if his nose was dry, you put something in his cannula. And we learned so much that you were with us. You're with us from the day we're born to the day we die and all our breathing challenges in between. When he was near the end of his life, a respiratory therapist came in and she scoured the hospital to find a mask that would be comfortable. And we called it affectionately the Jason mask. It was the bypass. They don't even use that anymore. Walter's lungs became so hard no air would pass. They would turn his bed upside down to let the air wiggle through. And they taught me the clamping method for cystic fibrosis children to break up that. So as a result of that, I realized no one knows. They're the unsung heroes. So I decided to form the foundation, and there's definitely been a need for it. And the Phil Award is the only national award that honors respiratory therapists, as nominated mainly by patients and family members.
Can you tell us a little bit more about the Phil Award?
Yes. The Phil Award is hospital-based, so hospitals become partners with us, and we help them get nominations from family and patients based on patient advocacy. What is that respiratory therapist doing to help you breathe easier? And they pick one recipient a year, and that recipient gets a beautiful Phil Award statue, which is a figure of a respiratory therapist in the back. Kind of looks like an Emmy. And then there's a butterfly in their hands, and when their wings are open, it's the lungs. So you, the respiratory therapist, have our lungs in your hands, and you're giving us the freedom to breathe. So we have partners in 39 states, plus the District of Columbia. We've honored over 835 therapists since 2016, and we have over 265 partners. So it helps hospitals recognize, recruit the best of the best in respiratory therapy. And as I said earlier, it's giving patients a voice in their care.
That's amazing. What a great impact. So tell us a little bit more about the Patient Advocacy of the Year Award that Brigitte's going to talk a little bit about her experience with.
Absolutely. This is open to any facilities where a respiratory therapist works. It could be telemedicine. It could be long-term care, hospital-based. You do not have to be a Phil Award hospital partner. And you're nominated on patient advocacy. What do you do? And it's a once-a-year award. We start accepting nominations in probably March or April, and we pick our finalists in August, and they come to the AARC where they are presented at a award ceremony. And it's wonderful because it's a collaboration between the AARC and the FACES Foundation.
How are the winners selected for the award?
Once the nominations come in, we take them and so it's not a popularity contest. We get all the names out in their hospitals. And then we have a panel of judges. There's some of our hospital partners. It's myself. It's someone from the AARC. And they go through the nominations and they select an honoree. And if there's additional people qualified, they will select a finalist or two.
And so why did you decide to partner with AARC?
We both have the profession. The respiratory profession is so important to us. So this is a way to give recognition to the profession, recognition to the respiratory therapists.
It's great. Brigitte, so what does receiving this award, or what has receiving this award meant to you?
It's been really amazing. It means so much. Years ago, my director and I started to recognize that respiratory discharges are extremely complicated, especially if you have a patient going home on a ventilator or with a tracheostomy tube. And we realized that we needed a more specialized discharge process. And so this just started out as an idea, and he believed in me, and he got the vice president of the hospital on board, and we developed a program. It was just really incredible, and it made such a huge difference in the outcomes for these patients.
That's amazing. So what specific experiences or challenges in your career has inspired you to become an advocate for patient-centered respiratory care?
In 2011, my dad had a stroke and he was on a ventilator for a while, and we had to get him home, and the discharge process was an absolute nightmare. And I was just sort of delving into the discharge process myself when this was going on, and I realized that there has to be a better way. And so that was kind of the push.
So I guess, well, that's kind of one patient story. Do you have another patient or family that really deeply impacted your approach to patient advocacy besides your dad, I guess?
So many years ago, we had a gal that lived in a very rural part of Oklahoma, and my director was on a leave of absence at the time. We had to get her home, and traditionally, like, the case managers and social workers would do the discharges, and we would kind of help guide them, at least the director would. But the VP of the hospital came to me and said, your director's on leave, and so you're going to need to help. And I had never done anything like this before. And so I tried to help guide. But what ended up happening is, even though this patient took a medical flight home, the social worker didn't realize that she needed to hire an ambulance to then transport, ground transportation, because she lived about an hour from the airport. And she hired just a regular transport, and they didn't have suction. And the patient ended up in the ER with a mucus plug. They readmitted her to the hospital, and then she ended up back in a rehab program for 2 additional months. And I thought to myself, this can never happen again. And so that was the real kind of path into the program. And so, we can't let those things slip. You can't let someone end up in that situation simply because they don't have suction.
Yeah. Wow. That's a sad story, actually, but it sounds like it made it for a better, path down in the future.
We've never had a problem like that again.
Wow. That's great. So this award recognizes innovation and best practices. What is an innovative idea or project you've developed that positively impacted patient outcomes? It sounds like from your story that you just told, like that was a very positive impact. Are there other things that you've worked toward, like innovatively, to make that impact?
Well, we basically developed an entire program. My title is Patient Education and Discharge Coordinator. And I actually have my bachelor's degree is in art. And so when I am teaching someone how to manage a vent at home or a tray, I have developed a PowerPoint with images that there's hardly anything you actually have to read. You can look at my schematics and know exactly what you need to do, how it's supposed to go together, how it's supposed to look. And it's custom built for every single patient, depending on, their needs and what kind of vent they're going home on and their settings, etc., including trach care. So that's one of the things that we did, and it's grown into a whole department. I now have another gal that works with me, and we're bringing on another employee who's going to start help train staff, because we're interdisciplinary. So we actually teach the nurses and the techs and other disciplines to suction and to monitor the vent alarms when they're in their classes, around the hospital.
Wow, that's great. What advice would you give to other respiratory therapists who aspire to excel in patient advocacy and quality care?
So if you ever have an idea, go ahead and spearhead that and do the research, make your case. Don't wait to be asked. Come up with a plan, almost write a business plan, take it to your director, take it to your VP, and you would be shocked at what you can come up with. I mean, for me, it led into a whole new career.
Just because this is a follow-up question, I guess, how did you go from like an art degree to a respiratory therapist? That seems like such an unusual path, I guess I would say.
Crazy.
Like, how did that all come? You mean you have some family history that like you wanted to make a difference in, but how did that kind of come about?
So after years of working in museums and galleries, it's a really hard way to make a living. I went into public relations for National Jewish, which is a respiratory hospital in Denver, Colorado, and that's how I discovered respiratory. And I remember walking by a room and watching someone and asking one of the nurses, "What is that? What are they doing?" I felt an instant connection.
Wow. Meant to be then, right?
Yep.
So looking ahead, how do you both envision the future of respiratory care, especially in terms of patient-centered approaches and advocacy within the healthcare system, since the changes like on the daily, I feel like, from what I've heard? So
I think a respiratory discharge planner needs to become a legitimate career path for respiratory therapists. I've heard it called a respiratory navigator. This has to become a true path and an option for people. I mean, that's what I want for respiratory. I want us to have the same like legitimacy as nursing, the same respect, the same marketability. And I'd love to see an NP version of a respiratory therapist, advanced degrees. I'm seeing that more and more. I think it's amazing. We need to take it to the next level.
Absolutely.
What do you think, Sharman?
Well, I think people still don't know what a respiratory therapist does within their own hospital community and in the community at large. So respiratory therapists need to be more active. We talked about this yesterday. It's just saying who they are and what they do. And then the hospitals need to do that. They need to educate the patient as to the value of the respiratory therapist and give patients a voice in their care.
It's great. So any other thoughts you'd like to share about the future of respiratory care or your work and with the foundation or your award?
I mean, this has been so inspiring. Like I tend to look like a younger person, but I'm actually 56. So
I would not have thought that.
There are times when I feel like maybe I'm sort of at the end but then when I come to these outings, I'm like, there's so much more, that I need to just explore. Like, what does life look like when I no longer want to walk the floors? And I know that there is so much more that can be done.
Absolutely. And I would just say, if you do not have the Phil Award program, you're not aware of the National Award, please go to our website, thefacesfoundation.org. Contact us, and we'll help you recognize your respiratory therapist. We'll keep you on top of the National Award so that you can honor the best of the best.
That's great. Thanks, Sharman and Brigitte, for joining me today and discussing the importance of patient advocacy efforts and the impact that the FACES Foundation continues to make every day. We really appreciate you.
Thank you.